Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Aminophylline. Its brand name is Norphyl. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Aminophylline. We'll then discuss examples of dosing and finish it off with side effects. I'll put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here will be the mechanism of action or how this medication works. So Aminophylline is a 2-to-1 complex of theophylline and ethylene diamine. Theophylline exerts two distinct actions in the lungs: bronchodilation through smooth muscle relaxation and suppression of airway stimuli. In terms of indications or reasons we prescribe this medication to a patient, well, Aminophylline may be prescribed in the treatment of asthma or chronic obstructive pulmonary disease, also known as COPD. With respect to contraindications or reasons we would not be able to prescribe Aminophylline, well, we just wouldn't give this medication to a patient who had a hypersensitivity to Aminophylline or any other component of the formulation. Now for some examples of dosing with Aminophylline. So when treating asthma, if you're using it intravenously and it's a loading dose for acute bronchodilation in a theophylline naive patient, we may see 5.7 milligrams per kilogram of Aminophylline of ideal body weight given intravenously over 30 minutes. If they were using the medication intravenously and they were 16 to 60 years old and a non-smoker, we may see an initial dose, this would be after the loading dose, of Aminophylline 0.5 milligrams per kilogram per hour, and a maximum dose of 1,125 milligrams per day, unless serum level indicate a need for a larger dose. As with all medications, there are some side effects or adverse reactions that patients may experience while using Aminophylline, so we'll go over some of those here now. Some common side effects may include diarrhea, nausea, vomiting or dizziness, as well as headache or insomnia. Some patients may experience a tremor or irritability, as well as restlessness or diuresis. More serious side effects include atrial fibrillation, intracranial hemorrhage, or a seizure. Alright everybody, that's all we're going to talk about today with Aminophylline or Norphyl. As always, I'm very thankful you took the time to come by and watch my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description, you can check it as well. So for today, take care.